Hi everyone, welcome to the video on Meconium Aspiration syndrome under the specialist area Paediatrics. Okay, so as an introduction, just a few questions to get you started. Question 1. How quickly after birth should the first stool normally be passed? Within 24 hours, within 6 hours, 12 hours, or 36 hours? So think about when you start to worry if the baby hadn't passed stool, and you'd be thinking of a blockage. So it's within 24 hours. So after then, you'd be thinking about intestinal obstruction. Okay, so question 2. What is a risk factor for Meconium aspiration syndrome? So is it essentially a low gestational age or a high gestational age? Considering that full term is 39 weeks. So it's greater than 42 weeks. This is because the fetus doesn't produce meconium until later in the pregnancy. So if the pregnancy goes past the due date and the baby's late, then the fetus has the potential to be exposed to the meconium for a longer period of time and therefore to aspirate it. So a higher gestational age is when they'd be at risk. And then question 3, does a Caesarean section increase or decrease the risk of meconium aspiration? So no difference, increases or decreases. So it would increase the risk. There is a much higher risk, essentially, if you are born by a C-section, and this is to do with the stress that the fetus experiences, and because usually C-sections are due to emergencies. So your baby's at higher risk of passing meconium and then aspirating it if they're under stress. Okay, so what we'll go through is what is it, symptoms and history, investigations, differentials, and then examination and OSCE tips. So Meconium aspiration syndrome is essentially signs of respiratory distress in the newborn due to meconium in the trachea. So what is meconium? It's the first feces of a newborn. It's dark green and is produced in the intestine. So as I've said, stress experienced before or during the birth may cause the baby to pass meconium stool whilst still in the uterus. So normally the baby will pass it within 24 hours of birth. It's unusual for the baby to pass it in the uterus, and then this is when the baby is at risk of aspirating it. The meconium stool will then mix with the amniotic fluid that surrounds the fetus, and then the baby may breathe meconium and amniotic fluid mixture into the lungs during or after birth. So this is just a sort of overview of the development of aspirating meconium and how it would obstruct and then how it would present. So sort of acute hypoxia, you'd present with respiratory distress, and then that sort of upper airway, and then lower airway, it will present with more systemic features and sort of an inflammatory response to that as well. So you could get an acidosis, and then you could get pulmonary hypertension as well as a complication. So there are lots of factors to think about when you want to diagnose this. Okay, so the symptoms and signs can present soon after birth or hours later. Essentially, you want to look for respiratory distress, such as tachypnea, chest retractions, and hypoxia. So these are sort of the chest movements that the baby will show, like trachea tug and subcostal recession. Cyanosis as well, and this is important when thinking about differentials because a lot of things can make the baby blue when they're born. Hypotension and diffuse rales and diminished breath sounds are sort of linked to respiratory distress. So a typical history, let's start with that first. So a term male, delivered at 39 weeks, emergency Caesarean section because of fetal tachycardia and meconium-stained amniotic fluid. So this is sort of the fetal response due to aspirating meconium. The mother is a 17-year-old, prima gravida, who has had group B strep positive culture at 35 weeks. So now you're thinking about whether the baby was put under certain stress and then maybe that's why they pass the meconium. So it's always a risk factor if the mother has had some complications during pregnancy. So at delivery, the infant is limp and blue with poor respiratory effort. So cyanosis and respiratory distress of 70 breaths per minute, mild retraction and grunting, and the skin is also stained green, suggesting that the baby has passed meconium and is staying in their skin. Atypical presentations. So the baby may present normally at birth, as we've said that it can develop hours after birth. So it's important to keep monitoring the baby. And also cyanotic heart disease or respiratory distress syndrome may be incorrectly diagnosed. So if the baby comes out blue or has poor respiratory effort, then you may immediately think meconium aspiration when it could be cyanotic heart disease, and we'll go through that with the differentials as well. So you always want to have this in the back of your mind. So investigations, these are to sort of determine it and also to rule out other differentials. So the chest x-ray will show patchy infiltration of both lungs, suggestive of atelectasis. So atelectasis is when there is fluid in the lungs and there is lung collapse. A full blood count and a CRP rule out infection, and a blood culture. And then, as I've just said, you want to also consider an echocardiogram because the baby may just be presenting with congenital cyanotic disease. So differentials, surfactant deficiency in preterm infants. So that's why you've also got to think about when the baby was born, because meconium aspiration is more common in term or late infants. Cyanotic congenital heart disease, always want to rule this out, as I've just said, with the echo. Lung hypoplasia, which is, again, normally preterm infants related to surfactant deficiency. And then if they've aspirated stomach contents or amniotic fluid as well, that could be another differential. So some OSCE tips. You want to know the risk factors because in the history you can pick these out and then this will help you narrow down your differentials. So gestational age is really important, as we just discussed with these differentials. Some of them only present preterm, or the most common in preterm. So gestational age, maternal history of any sort of disease that may cause the fetus to be in distress, and more likely to pass meconium earlier. So hypertension, preeclampsia, oligohydramnios, that's not enough amniotic fluid, and then Apgar Score, which we'll go through now. So Apgar Score is a test given to newborns soon after birth, and this basically triages the baby to see whether they need urgent medical care. So appearance, pulse, grimace response, activity and respiration. Those are all things you want to be looking at when the baby's born to assess whether there's anything more sinister going on or whether it's a healthy baby. Okay, so this breaks it down a little bit. So appearance, if they are blue or pale, then they'd score lower. Pulse, if it's less than 100 or absent, then they'd score lower. Grimace, so this is sort of you're looking at the reflexes. So if they're quite an active baby and they're crying or like pulling away, then they're considered healthy. But if these are absent or reduced, then again lower score. Activity, so this is the tone. If they're active, then it's fine, but if they're floppy, then they would be scoring lower. And then respiration as well. So if they're crying, have got a strong cry, that's fine, but again absent or irregular breathing sounds or slower, then you'd want to be thinking of something that's going on. So overall from that, if they score lower, then they may need some extra medical care such as oxygen, and you'd want to have this in your back of your mind if the pregnancy was high risk or it was a C-section delivery or the baby was premature. So that's good to know, not just with meconium aspiration but delivery in general. Okay. And then it's just summarising again. So question 1, how quickly after birth should the first stool normally be passed? 24, 6 hours, 12 hours or 36? So it's 24 hours. So normally babies will pass it after delivery within the first 24 hours, but then it becomes a problem if they pass it within the uterus, and then they may aspirate it. So meconium aspiration essentially passing it earlier than normal. And then obviously high risk would be a late gestational age. So risk factor, therefore, full-time considered at 39 weeks, so it'd be greater than 39 weeks, greater than 42 weeks, or a premature baby. So it's greater than 42 weeks, again, because the fetus is more likely to pass meconium if they're in the uterus for a longer period of time. And then final question, does a C-section increase or decrease the risk of aspiration? And it would increase because the baby is under a lot more stress and is likely to pass it during the delivery. Okay, thank you for listening. I hope that helped.